Good morning, everybody, and welcome to South Dakota HealthLink's 6th webinar series. Heather, you can advance. There we go. Today we will be discussing orders and results. Please note today's webinar is being recorded and will be made available for future reference for those who may have missed this webinar. Next slide. Today's agenda will include a short overview of our interoperability services, an overview of electronic results, and an overview of orders. My name is Mandy Steginga, and I'm the Information Technology Specialist with South Dakota HealthLink. With me today is Heather Wolken, who is a Clinical Engagement Consultant with South Dakota HealthLink. The rest of our team is listed below.
Awesome, thank you, Mandy. So like we always do in these webinars, we'll start by giving an overview of all of the services that we provide to our members here at HealthLink. Our mission as an HIE is to foster the sharing of information through a secure platform, which we achieve through several different products that you see listed here. The first one is our point of care exchange. This is our platform that houses clinical history from organizations all over the community. This includes lab results, progress notes, medication histories, and clinical summaries from over 70 hospitals that can be accessed by providers and used to pull back meaningful, quick information right when they need it. This tool enables clinicians to spend less time tracking down medical records and more time treating their patients. Notify, which is the next one on the list, also aims to keep providers engaged with their patients. This is our clinical event notification tool. This tool takes information that could be searched manually in point of care, and it actually automatically notifies providers when the information is received. So let's say you're an outpatient clinic wanting to engage with your congestive heart failure populations to make sure they're getting timely follow-up after discharge from an inpatient stay that is outside of your organization. This tool allows you to subscribe to a notification that pings you right away when someone from that cohort is discharged so that you can get them into your facility for follow-up right away. You can also use this notification to go back into point of care and see if their medications were changed during that inpatient visit, for example. This is a great example of how these two tools can be used in conjunction with one another. We also have the ability to electronically support closed loop referrals. And then the last one on the list here I'll speak to quickly as well. This fall, we'll also have a new product coming out. This is our population health analytics tool. This takes the clinical information that is separated by patient and point of care exchange, and it aggregates it so that you can run quick analytics on it. So for that heart failure example, maybe you haven't been signed up to receive notifications, but you want to know who out of your outpatient clinic with a primary diagnosis of CHF had an inpatient admission within the last 6 months and hasn't been seen in your clinic since that admission. This tool would allow you to go in there, define that criteria, and run that report to bring back that list of patients that fits what you defined. So we're really excited to see that coming soon. I just wanted to call out that we do support multiple interoperability tools, all of which are available to our members. Today, however, we will be talking through our results delivery and electronic orders and how those can help organizations standardize workflows, increase capacity, and drive towards better patient outcomes for our community. So let's start this conversation about electronic orders and results with some core objectives that we aim to meet with these applications. First, we aim to meet providers where they're at. This means that integrating lab ordering and results delivery into their native EMR whenever that is possible. We're vendor neutral in this effort, so we'll accommodate almost all EMRs. The main goal with all of our tools is to make the process of sharing information easier, quicker, and more streamlined using technology. Connecting results delivery and ordering into your organization's EMR is a really big part of that. So while we can all agree that ordering and results processes should be transparent, should be standard in most situations, and they should be timely to everyone involved, this is a lot easier said than done. Today, many orders are still delivered by paper or fax. This takes a lot of time away from the patient that's instead spent doing, the clerical work involved with that process. So you'll see delays with this traditional workflow, which slows down treatment and it frustrates providers. So shifting to an electronic workflow streamlines the process, which again saves time and reduces errors. An additional advantage we've found is that having the clinical information from lab or procedure results electronically means that you can contribute richer data to your community record. Ultimately, this can allow you to run analytics on that important data and determine opportunities for better managed care, or just generally gain better insight into disease patterns in your community. So continuing on that thought, here are some of the common drivers that we'll use to achieve those goals that I just mentioned in the last slide. So we commonly hear that completing orders and sending out results on a secure electronic channel decreases errors. This is largely because of the consistency that's added to the process when you move away from paper. A big driver of success, probably the biggest driver of success with orders, is also time saved, which we know in healthcare can be invaluable. The value of time in healthcare is much more associated with lives than it is with dollars. That's because it's commonly accepted, right, that the sooner a patient gets to the right care with the right resources, the better their chances are for a positive outcome. So having this time back allows organizations to use their time in a more productive way than traditional manual processes would. So if you think of these drivers moving your organization forward towards goals, I would think of HealthLink's electronic orders and results as like a gas to that car, right? So these are tools that you can use as fuel to propel you towards your goals in many ways. So let's dive into how these tools work. So we'll start with talking about results delivery. We wrap these tools up into one discussion because they are so related, but you can think of them as two tools. Results delivery is very straightforward and it's really quick to deploy. So there are many situations in an organization where it would make sense to only move forward with electronic results delivery and not orders. So that's the first important call out, right? You can utilize results without committing to our orders tool as well. Orders does have more depth, but we'll go over that later. Okay, so to start talking about results, I'll just clarify one thing first. I often say, I think I even did earlier, but I often say lab results because those are so commonly ordered. But results can mean anything you'd order, right? A diagnostic test, an ancillary service, for example. So if you're an organization that receives orders and performs any sort of test to relay back to the ordering physician in whatever capacity, this can work for you. So it's not just labs. So there are two scenarios of organizations where we can use the results delivery tool. The first is the most common and preferred. This is with a direct connection to your EMR. So this is seamless for the patient and provider, and I'll speak to our experience with doing this with various EMRs on the next slide. But the second option are for those primarily paper-based practices. So we have a simple like web-based application called the Web Inbox that lets organizations view and print results online if they don't have an EMR. Both the sending facility and the receiving facility have both of these options available to them, which can really help connect different sized organizations, despite their EMR resources. So in other words, a paper-based facility would be able to receive results from an organization that uses the EMR connected version of this tool. Going back to those core tenets of ours and kind of in the spirit of meeting organizations where they're at, results delivery can work for many different organizations, and it helps make the distribution of that important clinical information a lot more accessible throughout the community. So I mentioned I'd tell you a bit more about the EMRs we've integrated with in the past, and it's quite the list. We have all the big guys here: Epic, Athena, Allscripts, ECW, but we've also had success with homegrown custom EMRs and integrating with results delivery. We don't actually embed or make any changes to integrate results delivery. It's just a data connection. We open up a pathway for communication and just deliver the results behind the scenes. So the next question is, with all of these options, what does that look like in my EMR? So let's take a look. So this is an example of what the user experience looks like with a connection to your EMR. Obviously, the layout and design of each EMR is different, but the point here is that it matches the design that you're used to seeing, and it reads like a result you'd traditionally receive. Just a personal story here. I spent a bit of time working as support staff in an outpatient cardiology clinic, where we would, docs would often order like full cardiac panels, and patients could go get them done, at a variety of different locations. And then the patients would bring them back in themselves sometimes, or we'd get mailed them or fax them. And what we do then with the paper results is we'd manually input all of the values for the CBC, the lipids, the troponin, like the whole panel into the EMR, so that the cardiologist could then read them. It took a fair chunk of time, as you can imagine, to do this. So it'd be prioritized after seeing patients for the day, and it really added to the turnaround time and can delay care. And of course, that clock starts after you receive the results in the first place, which, in my story, the patient brought them in, but many don't. So you have to hunt those down too. So having this directly in the workflow already in the EMR is just a massive time saver, and it reduces human error as well. For those organizations not utilizing meaningful use technology, we do have the ability to deliver results in a third-party application. This is web-based, like most of our other tools. You may be familiar with, like point of care exchange I talked about earlier. Results can be dropped right in there to access instead of routed to an EMR. Honestly, this wouldn't apply to most organizations. It was something we saw mostly used as a transition tool before meaningful use was the standard, and as it was being adopted. However, we do strive to meet the needs of all organizations in the community, despite their access to resources. So this is still an available option if it's needed. All right, moving right on forward to orders here. This tool, like I said, has a lot more depth when it comes to how it works. There's more required than just setting up that communication channel, but the benefits are the same. It's very impactful to businesses to send orders in a consistent, streamlined, and electronically secure way. So to set the scene for talking about orders, we'll establish a use case, and we can use that use case for context. So in this situation, we'll talk about the clinical support staff of an independent PCP's office. The physician wants to order a CBC and a chest x-ray for the patient. And as the support staff, you're going to fill out that order. And you plan on sending them to a local community hospital so that they can get their testing done all in one place. In this situation, you'll log on to your EMR, you'll select the diagnosis, the test, answer any order entry questions, and then transmit the order all within the EMR. And then after the testing is done, you'll receive those results back into the EMR as well. Okay, so how does that work? Well, diving a bit more technical here for just a moment, similar to results, you have two options with orders. First is placing it through your EMR, and then the second is through the web-based application. So starting on the right and moving to the left, you can see those two different channels, and then the rest of the process is the same. So the order is placed with entry questions and requiem, like maybe the hospital's requiring the patient to fast before their lab. And these are specific to the receiver, so the hospital in this situation. So the hospital receiving these orders requests certain questions to be answered when they set up their end of the system. And then it's populated for the PCP office that's completing the order in their own EMR. It's automatically populated. So the order, once you complete it, it goes through a firewall and then across the grid, which is just our term for secure lines of communication. And then it arrives at patient registration, which is done for you. And then finally, it arrives at the lab tech. Those ordering questions you answered when you filled out the order are delivered here. And once the order is completed, the results go right back to the provider, the same path, which closes the loop and makes communication open for both parties. All right, there's the blue dot going back to the being delivered back to you. So that's a glimpse of the technical side. If you're interested, these are more high-level webinars, but if you're interested in learning more about this piece, please reach out. We'd be happy to hold a technical conversation with our technical team about this. So again, for orders, what does that process look like for providers entering the order? Similar to results, it's all done entirely within the native EMR. So when a patient goes for a visit, the staff likely already has the EMR pulled up. So it's right there in the workflow. You don't have to go in and out of multiple environments to order each test. Again, this saves time and it decreases the risk of error. Another advantage is that the ordering experience is also already familiar because it's in a layout and design that clinicians are already used to within their own EMR. In the spirit of interoperability, these results will also be able to be viewed in our community record. I've mentioned it a couple times, but the point of care exchange, it's where you access all of the clinical information contributed to the HIE. A benefit of this is transparency within the community. Of course, the PCP who ordered the CBC and X-ray wants to review them, but maybe the patient will go see a different specialist or two who would also benefit from this additional view into the patient's health. It benefits the community greatly by having the accessibility and transparency that point of care exchange allows. This also benefits you as the ordering provider, though. I mentioned our population health analytics tool, and what's great about having your results in that community record is that this information is stored securely and electronically, and you can look at in one place, right, where you can look at the patient and your population over a longer term very easily. You can compare several results over time in one place, grab insight into trends way easier than if you were just keeping results in multiple locations or on paper. So this leads into my last slide on orders and results for today. The benefits of integrating lab ordering and results delivery within the native EMR and within your kind of existing workflow are undeniable. We've touched on many of these throughout our discussion today, but to reiterate, moving in this direction often increases capacity for other tasks. It reduces errors, and it empowers providers to look at the bigger picture of the population's health. All of this ultimately helps improve the quality of care for patients that we dedicate our professions to helping. So we looked at what integrating orders and results both look like in an EMR. We talked through an option for folks not yet using an EMR, and then we weaved in the value that that adds as we went. So as always, we welcome any questions in the chat or invite you to meet with us personally if you want to continue this conversation. Before you go, I do want to let you know about our next webinar. This next one will be in about a month, and it'll be about our brand new population health analytics tool. This is a new offering for us. It's a really powerful tool that will help organizations quickly and easily run reports on information that they contribute to HealthLink. And you can do this without knowing how to code or navigating around a database. It's very user-friendly. So we're excited about this and we're looking forward to it. Additionally, we've done several webinars about the different tools I mentioned in the beginning, and they are all on our website, which is sthealthlink.org, where you can view them on demand. So my last slide today, I've dropped our contact information. We would love to have a conversation with you about orders and results or any of the other interoperability tools I mentioned today. Please, honestly, feel free to reach out at any time. Thank you so much for your time today, and we'll see you again next month.